poorly soluble drug is one that has a low solubility. Maybe to better illustrate this, you can think of sugar and water. And when you put sugar in water, these sugar molecules are interacting with the water molecules in such a way that it becomes a solution. There are no solids visible in it. But a poorly soluble drug will prefer to remain in its solid state than to interact with the molecules of your solvent. And so a poorly soluble drug is one that does not dissolve in your solvent. For a drug to be orally available, it needs to be permeable through your GI tract and soluble. You can see here on the biopharmaceutical classification system chart that drugs are divided into 4 categories. Class 1 drugs are those that are soluble and permeable. Class 3 drugs are those that are soluble but impermeable. Class 2 drugs are those that are insoluble and permeable. And Class 4 drugs are those that are insoluble and impermeable. Class 1 drugs are easier to formulate, but Class 2 drugs are what is becoming increasingly more common. In order to dissolve your compound so that it becomes orally available, you need to know how to dissolve it. And so overcoming that insolubility is an important part of a drug formulation process. The first thing that comes to mind is pH adjustment. If you know your drug is poorly soluble in water, then you can adjust the pH up or down with acid or base in buffered media to target an ionizable site. That is, a site on your drug that can be protonated or deprotonated. If that doesn't work, the next step generally is to move towards a complexing agent. These are the cyclodextrins. Hydroxypropyl beta-cyclodextrin and sulfobutyl ether beta-cyclodextrin are the most common ones. These are well characterized and very safe, can be dosed in amounts up to 40% in solution. If those don't work for your drug, then the next step would be co-solvents. Those encompass a wide range of components. They're generally a bit more toxic. This can range from things like surfactants, which can help wet your drug and pull it into solution, oils, which are good for lipophilic drugs, and more exotic things like phospholipids and bile acids. So those would be the common ways for solubilizing a poorly soluble drug.